Many women at one point or another have suffered from vaginal yeast infection. Yes, is that common? So today I'm here to tell you what you should do if you have vaginal yeast infection. It's not something to be shy about, it's not something to be afraid of, but then you need to treat it properly for your health and for your comfort. Now, what is this vaginal yeast infection, otherwise known as candidiasis? This is a fungal infection caused by overgrowth of yeast in the body. So this yeast is actually resident there in the vagina, is not meant to cause any harm or any problem. But the problem comes when there is an imbalance. There is also bacteria, normal healthy bacteria known as normal floras, resident on our body, in different parts of our body, the vagina inclusive. So this yeast infection is actually caused when there is an imbalance in the healthy bacteria. Vaginal yeast infection occurs when there is an imbalance between the healthy bacteria and the yeast. Anything that will cause the healthy bacteria to decrease will cause an overgrowth of the yeast. Now, you can liken it to a scale, a two-armed scale. On one side you have the healthy bacteria, and on the other side you have the yeast. This scale must be at a balance, it must be at an equilibrium at every point in time. Anytime there is an imbalance, it will cause an infection. So this is what actually is vaginal yeast infection, otherwise known as candidiasis. What are the causes of candidiasis or vaginal yeast infection? This could be as a result of douching, use of scented soaps, use of antibiotics. You might be using an antibiotics for something else, but then it can affect the normal flora in other parts of your body, leading to vaginal yeast infection. If you have a disease condition such as diabetes, or you have a compromised immune system, that can also lead to vaginal candidiasis. Also, high level of estrogen as seen in pregnancy can result in vaginal candidiasis. That is why most pregnant women complain of itching down there. Now, what are the signs you are expected to see? You're going to itch seriously down there, and because of the itching, it is going to cause a lot of cracks around the vaginal opening, and when it causes that, it leads to burning sensation while urinating. So there is redness in the area, and also there is whitish thick vaginal discharge, otherwise known as cottage cheese discharge. There can also be painful intercourse. For the treatment, all you need to do is to take an antifungal drug, which can be in the form of oral formulation, cream, or pastries. Now note that if you're pregnant, you need to stay away from oral antifungal drugs. So you need to go to your pharmacist and ask for an antifungal drug, whether the oral formulation or the cream, so that you can use it. However, if the symptoms persist, you need to check with your doctor. How do you prevent vaginal candidiasis? What are you going to do to make sure that it doesn't keep coming back? First is you need to keep your VJ clean and dry. Avoid using scented wipes after urinating. Also, wash your vagina with just clean water. The vagina itself cleansing, it doesn't need an extra help to get cleaned. So you just need to wash it with water. Stop putting things in there. Stop douching. After using the toilet, make sure you wipe from front to back. Even if you have a baby, that is how you should also wipe, so that you don't introduce bacteria from your anus to your vaginal area. Of course, you know that the vaginal opening is really close to the anus, like they are neighbors. Face me, I face you neighbors. I don't know if you understand. Also, make sure you wear cotton underwears that are clean, dry, and not damp. And when necessary, allow your VJ to breathe. Don't forget to subscribe, like, and leave a comment. Thank you, and see you in my next video.